So hello to all the viewers. I've got a top ranker with me, Dr. Anantini, who has secured an amazing rank, common merit list rank of 3 and AIMS merit list rank of 9 in the INISS DM Neurology entrance examination.
Thank
So
you, sir.
you are actually having 2 single-digit ranks with your name. Are you used to this? Are you a topper ever since you were a student, or is it the first time?
Well, I would say that I've definitely not got a single digit rank ever
Right,
before.
right,
So that is a big surprise. I was shocked actually because
right.
didn't expect it, especially right after my MD got completed the first attempt. In my first exam, I didn't even give NEET SS.
Right. So can you just tell me, about your background? Like you're from which place, which college did you do
Yeah.
your MBBS from, and subsequent post graduation?
Yeah, I've been born and brought up in Bangalore, and I did my undergraduation in KIMS Bangalore, and
Okay.
I did my post graduation in Bangalore Medical College.
Okay.
So yeah, I completed my post graduation this February.
And see, you recently completed your post graduation, so obviously you
Yes,
had a time limitation for preparing for the INI.
yes.
So can you just tell the viewers how DocTutorials helped you in preparing for the INI in such a short span of time?
The main thing which I felt Doc Tutorials helped me with was that it had a quick revision program.
Right.
And that was the most important part in helping me finish the syllabus because I don't think anyone is capable of finishing the entire medicine or even neurology in a short period of time of maybe 2 months. So
Okay.
when I took Doc Tutorials, I mainly focused on the quick revision program. And I
Okay.
used to open Harrison with it. And that was the best part of the quick revision program because I felt like many tables used to get discussed right from Harrison, pictures used to get discussed right from Harrison. So I had used Harrison throughout my MD to study. So when
Right.
I had to revise and I had to choose high yield topics, this was the best option because I could go back to a source I was familiar with and I was being able to focus on things that were asked. So
Right.
ultimately, that was what helped me the most.
I think that makes revision also a lot easier, right? Because
Yes, it
you had
does.
a short span of time to prepare. So obviously you would have gone through these QRP videos, and
Yeah,
that would have made revision also a lot easier, right?
yeah,
Right. Now, along with this, MCQ practice obviously is very important because
yeah.
you're preparing for a very competitive exam. So, how useful were the question resources, that is the Q bank of doc tutorials in your preparation?
The Q bank was very good because, especially the explanations in the Q bank, because they used
Right.
to give tables that were right out of Bradley. So,
Okay.
again, the explanation, if you read it once or twice and then go back to Bradley and read the entire topic, that was what was very good because normally in any other source, you will get just a line or two which as an explanation, and that won't be satisfactory to understand everything. So the
Okay.
explanations were very good, and it also allows you to go back and resolve the module 2 to 3 times. So in
Got it.
modules where I did not do well, I used to resolve it again. So
Got it.
that was also good. And I made a custom module in neurology towards the end, and whereas to solve 80 to 100 questions per day.
Got it. So, approximately what percentage of the doc tutorials Q bank have you solved?
I completed the entire Q bank for only neurology. I completed the entire Q bank.
I think very aggressive Q bank solving is important because I just
Yeah,
took the interview of certain other toppers as well.
yeah,
Rank one for AIMS merit list, I just took Dr. Pratiksha's interview. Rank one in the common merit list, I took the
mm,
interview of Dr. Madhu. She also said that entire Q bank she has solved, which goes to show that with every passing year, the exam is becoming more and more competitive because I'm seeing very
yes.
good scores for the exam. I think the scores are also going up, which means the exam is also becoming more and more competitive. And I think candidates are putting genuine effort because I can compare it with previous years. Previous years, 60% Q bank, 70% Q bank. This is what an average topper also would do. But again, I think you people are studying so well. Maybe that is the reason why. Right. So coming to the grand test of doc tutorials. So how did you feel the grand test helped you in your preparation?
Yeah, the grand test was a realistic grand test because normally they tend to make grand tests very difficult and that's demotivating. Here, I
Right.
felt my rank in the grand test also correlated with what I got in the end.
Okay.
And it also was like even the type, the difficulty level of the questions, especially of general medicine, correlated well with the exams. So I think it was very useful.
Right. Right. And coming to the round two, that is the the interview round of INI. So
Yeah.
I had uploaded some mock interview videos in the
Mm.
app. Plus, I have shared with you all the previous year's interview questions that the students actually sent me after the actual interview. So, how did that actually help you in shaping you for the interview?
Again, things like CT and MRI, even though we have studied it during our MD to tell it properly in a correct sequence during the exam, that is very important, and that was what was covered in the videos.
Right,
And also, when we had a very short time, we had, I think, just 3 to 4 days before we had the interview date come, between the announcement of the interview dates and the time of our interview.
right,
So that also, in such a short frame of time, nobody can study everything. So I think it helped to you solve study certain topics with more focus.
right, great, great. So it is actually a your story to crack the exam in your first attempt. I think should be an inspiration for the medicine residents listening to you as well. Because if you do your residency well, plus you've spent a few months for your preparation aggressively, I think to get a rank like Dr. Anantini has scored in her first attempt, is definitely possible. So, did you expect this rank? Be honest. After you had given
No, I
the
didn't. I
no,
did not. Like, I always thought that I might have to give the exam another time because everyone told me that it'll you with very difficult the first time, get an idea of the exam. Next time you can give it. So
got it.
I went, but I also wanted to clear it the first time because going through the same exam again and again is just very difficult.
Exactly. And also, I feel, for exams that come after your, say, MD,
Yeah.
it's always the first attempt that is your best attempt because you've already prepared for the your MD finals.
Yes,
So
that
you are
actually
at the
made a
peak
big
of your knowledge.
difference.
You are at the peak of your knowledge. So if you can do some fine tuning, some MCQ practice, that's the best time to do it. Otherwise, you will have to redo the entire process again. So I think
Yeah.
it's something good that you have pointed out. I think this is an important advice to the juniors as well. If you can just focus a bit on your entrance preparation as well along with your MD finals, that definitely would help, and you can crack in your first attempt as well. So Dr. Anantini, once again, hearty congratulations for
Thank
your
you, sir.
amazing success, and wish you good luck. Thank you
Yeah,
so
thank you,
much.
sir.